CSIS launched just recently a task force, a U.S.-Japan task force on cooperation after 3/11, after the disasters of the earthquake, tsunami, and now the radiation crisis in Japan. This is an effort undertaken in collaboration with the Japanese Business Federation, Keidanren. There is a health component of this. There's a working group on health, which I'm involved with others, that's beginning to look at the whole question of, will these changes, these traumas that impacted Japan, have a major catalytic impact in Japan in stirring a desire for reform and for rethinking in the delivery of health in the area, the Tohoku region in the northeast, which was most heavily impacted. There are populations there that they're farming, fishing communities, heavy displacement, over 130,000 people still displaced, very deeply traumatized by this, lots of hypertension and other evidence of trauma, post-trauma consequences. There's obviously within the area around the Fukushima reactors, the radiation dimension. There are going to be special needs for these populations because they're heavily elderly, they've been displaced, they've been traumatized. One of the questions here is how to build back better. How, as Japan moves through this period, as its national reconstruction plan is framed out and moved forward over the course of this year, as people are moved from their evacuation centers into temporary housing near their original communities, and communities are reconstructed, housing reconstructed, and clinics are added in, and new forms of health delivery are brought in. Is this a major moment for a rethink around the delivery of health systems, and what forms does that take? So, as we move ahead in this task force, we will be visiting, a delegation will be visiting Japan in mid-June for a series of consultations and listening really to where the thinking is moving within Japan on these questions, and how U.S. official and unofficial entities could be brought into the picture over the medium term in support of Japanese-led initiatives.